to get the public, the communities, everybody, every organisation involved. So when Jackie and the team said, look, what about putting our tender in? What about putting our bid in? I said, okay. So having been that patient, I know how important the patient experience is to people who are putting it together, because once you've been there, it's very hard coming back. And I said to Jackie, fine. And me, as a patient, it's nice to get people to listen and say to them, look, it's not just the operation and coming out. It's the aftercare, after the hospital care. It's the people who are at home, on their own, frightened to go out the door, getting used to getting back into the society again. And that's exactly what we did. So the way I was looking at this model that we were putting forward, I was looking at something from a patient's point of view, from the start of the process right through to the discharge, from one element of the service to another. It was great the way they did it. I was, as a patient, sitting on this panel of ours, as a local resident as well. I was fully involved with all the consultations that they did, and then invited with the other patients to join the public tender group to put our tender in. Our involvement was fully supported by the PCT staff, and we agreed on the important patient experience questions, and we scored the bids as we seen them and looked at it. I'd never sat on a panel like this before, but I was surprised at the depth and breadth of what was going on with this panel. The intensity that goes into trying to procure the service, and it made me feel an awful lot better, an awful lot easier sitting there and seeing the efforts and everything else that had gone into this approach. Maybe in the long run, you know, as a patient, or what was being provided was that ultimately it's the outcome that counts, not the process. However, the people on the PCT and listening to this, listening to me as a patient, this has been reflected in the services that have been delivered. And more important, it's made a really positive difference to the residents of Knowsley, and helped me later to set up my own an organisation from Knowsley, which is the Knowsley Chest, Heart and Stroke Support Groups, known as CHESS in Knowsley. And from speaking before and telling everybody about it and telling everybody about the experiences, it's got round the borough, and we worked more on prevention than cure, stopping people what I'd been through. I just treated it as I was the only one. But your family that's involved, everybody who was put under pressure and what have you. So the prevention, which led on to things like healthy eating, try and get into some exercise program, do some healthy lifestyle, involving, even this morning, some ungodly hour, I was up about 5 o'clock to come get down to the train. But anyhow, I was talking to the cab driver, said to me, taking me to the station, where are you going? Like, you know, this hour, am I going anywhere nice? I said, yeah, Birmingham. He said, well, so he said, okay, what are you going for? And I was telling him, and he said, we all know. We've got it on the cabs, we've written it in the cabs, we're all going, we're all looking for healthier lifestyles, we're doing this, we're doing it. And when I got out at the station, he shook my hand and he said, best of luck, mate. He said, get up there and make them have it, shake a leg. So there we are.